this all started with a private member's bill put forward by Elizabeth May of the Green Party. And that all started because of the lobbying of our own Brenda Sterling Goodwin, we are here because of Brenda, who has been very much an inspiration to me throughout my battle with Lyme personally, and also now that I did get better, I was fortunate as I continue in research. So, Brenda, Elizabeth May, private members bill, when I first heard about it, I think I actually vocalized my thought, which was, what a lovely idea. Private members bills don't have a hope of getting anywhere. Elizabeth is a determined lady, so she wasn't listening to anyone else, so it actually became law. It had all party support, it was nonpartisan, and it really was an incredible vision that was taken to fruition with a lot of work. So that's the good news part. The process, once this became law, it was a two-step process. The first step was to hold a conference to get everyone to the table, the patients to the table, the infectious disease experts to the table, other medical professionals to the table, as well as researchers. And that was a conference. And then that was intended to inform the federal framework. And that federal framework was supposed to give us direction going forward. So the first part of that went really well. This was organized by the Public Health Agency of Canada, and they decided to set up the conference by bringing essentially both sides of the debate to the table, the infectious disease specialists and the patients. And we had a very busy and very rocky year planning the conference, but we did achieve a conference, and that conference was probably unique in that it had everyone's voices heard. Granted, there were a lot more patients there than infectious disease specialists, but I don't think that's a bad thing. It's certainly not surprising. So the conference had everyone there. After the conference, there was this black box where the conference proceedings vanished, and after a 9-month gestation, and it really was 9 months, out popped the federal framework. And the response, my response to the federal framework is, you've got to be joking. We could have written this before the conference. We could have written this 10 years ago. In fact, didn't we write it 10 years ago? They did put it out for a call for comments. There were lots of comments. Certainly my comments were, could we get the science right at least? There were minor revisions, and then we were left with the federal framework. One part of the federal framework is that they allocated $4 million in research funding. And that was, the patient community was very vocal and very instrumental in lobbying for that research funding. So because I'm a researcher, I'm going to focus on what happened with that. Okay, so the powers that be, in their less than infinite wisdom, decided that the way to deal with this $4 million was to fund one research network in Canada to work on Lyme disease. And that's a little bit of a problem because there were, in fact, 2 research networks in Canada at that time. So there was a group that at the time was called the Queen's Lyme Research Network that was primarily the infectious disease specialists and public health people. They've rebranded as the Lyme Research Network. And then there was another group which involved patients, patient advocates, researchers, and healthcare providers, primarily the physicians who actually treat Lyme disease patients. At the time we were called the Canadian Lyme Science Alliance. We rebranded as the Canadian Lyme Consortium. Nevertheless, there were 2 groups, and there was $4 million for the winner. Okay, short version of that. Money on the table, the knives come out. Who would have thought? The only thing that could make a bad situation worse is to say there's a big prize and only one of you gets it. Okay, so guess what? So this was not a big surprise. It's a little bit annoying. This will be the one opportunity, the one time I allow myself to wallow in a bit of bitterness. The requirements for the network is that they form a biobank, which is a collection of biological tissues from people with Lyme disease. They do tick surveillance, and they do something about chronic Lyme. The Canadian Lyme Consortium already has a biobank. I started building one in 2012. We've been doing tick surveillance since then, and we actually believe in chronic Lyme, which the other group doesn't even acknowledge exists. Nevertheless, okay, bitterness over. So, yeah, that didn't work out quite as well as it could have, at least from my perspective. Oh well. So now we have to go forward. And there is still work to do. There's no point going home saying, oh, well, people didn't like us. I guess we're just going to go curl up at home and let everyone die. No. So the Canadian Lyme Consortium is going strong. So I'm going to describe how it works. Then I'm going to talk about some of the stuff we've done. I'm going to tell you a little bit about what some of the students who are presenting today are going to be talking about. And then I can open it up for people's comments and questions. So that's basically what we do. So, how the CLC is working. Now, one thing to note is that we are 100% volunteer-driven. I do this after I've done all my marking in the evening and late on the weekends. So, please be patient. It's a bit slow. But the idea is that we start, this is very much grassroots. We are starting with people contacting us and saying, this is what I went through, I think this is important, let's think about it. So someone might say, well, what about congenital Lyme? Can I pass this on to my baby? Someone might say, I'm worried about Lyme disease in the blood supply. Someone else might say, what about transmission through cat bites? So these are ideas. They come in, and they come into something we're brilliantly called the Idea Incubator, where ideas incubate. That's such a non-creative name that I pulled logos off Google Images this morning. The next thing that has to happen is because we do everything as a partnership. So if you are the only person in the world who is worried about alien brain rays making you have 6 toes, I have all the respect in the world for your passion, but it's not going to go anywhere unless you can get a researcher and a clinician on board. However, once those 3 groups are saying, for example, if something comes from the patient community and this has happened, I'm worrying about congenital Lyme, I'm worried about whether I can pass it on to my baby. Clinicians are saying, yeah, this is worrying, I kind of see this in my practice. A researcher then says, yes, this is how we could study it. Then it goes forward to an idea hatchery. And then out of necessity, this whole thing goes dark because the next stage is where we're trying to find money to do things and actually setting up the project. And that has to be done somewhat outside of the public light just to stop us from getting too much harassment. So that's the basic idea. Oh yeah, and sorry, I was doing this part late last night. Hatchery, that's a chicken. I really like chickens. It's irrelevant. Okay, progress to date. So essentially the Canadian Lyme Consortium got going right after the conference. The conference was a wonderful way to pull people together. There were a lot of ideas generated at that time. We knew it was going to be a long time for the framework to form. We didn't necessarily have a huge amount of confidence in the framework, so this was very much just a get up, get go, let's get going. Okay, so I'm going to highlight 3 areas where we've made progress at this point, and mention the other presentations. So the first thing is stopping people from getting Lyme disease. If you don't get sick, you don't have to worry about how to diagnose this and how to treat it. You can avoid most of the controversy. This is a good thing. So in the past year, we've been working with the Ministry of Education in New Brunswick to set up a basically tick ed, in their science class. And this has now been, after we ran a very successful pilot project last year. In the picture on the top left, your top left, we have one of the students in my lab who was absolutely phenomenal. She spent a lot of time with the high school students, did some teaching, taught them the difference between the different types of ticks, taught them about how science actually works. And that was successful enough that the New Brunswick Department of Education has adopted that. That's now part of the high school science curriculum. So what I'm hoping is that's going to prevent a lot of illness, because young people are one of the two big risk groups for Lyme disease because they're out and about in the greenery. Okay, next thing, surveillance. Tick surveillance is one of those identified needs. The point is to identify the risk of Lyme disease. So we've been doing tick surveillance, and we generate little dots on a map. For those people looking at Nova Scotia saying, why has Nova Scotia got fewer dots when we have more ticks? That's because the funding is for New Brunswick, and I'm not supposed to test Nova Scotia ticks. And if people ignore the bits on the website which says this is for New Brunswick ticks only and send it to me, I'll test it anyway. But I didn't say that. Okay, so this is 2016 ticks, different species, etc. We do all sorts of ticky stuff. I also would want to point out that we're doing wildlife surveillance, which turns out to be a much better predictor of risk, as well as checking dogs in your area. Because if your dogs have Lyme disease, dogs live with people in the same communities, same house. If a dog is attached to a person by a leash that's 6 feet long, generally if that dog has been exposed to an infected tick, so has the owner. So those are better ways of doing surveillance, and we've also been engaged in those. Okay, biobanks. We got lots of biobanks. You can biobank anything. If it used to be alive and you can put it in a freezer, you can make a biobank of it. So we have dog, horse, wildlife in its multitude, and human in some cases. And that's really important. It's a tremendously valuable resource for people wanting to do research on many different aspects of Lyme disease. Okay, and a talk, Hazel's talk, 2 talks from now, will be talking about one of the biobank samples. We are also doing other work on ticks, and there are 2 tick posters out in the lobby for you to visit during the break. One is on different Borrelia species in ticks, and the other is on using canine Lyme disease and tick infection rate on Prince Edward Island to predict the risk of human Lyme disease. And the talk right after me will be by Joseph Beaton, talking about contact transmission of Lyme, so non-tick vector Lyme disease. Okay, so that deals with the research part of things, and just to take things back to where we started with PoliTicks. Probably the best thing that has come out of this entire process of drawing people together to deal with the problem of Lyme disease is solidarity. That's absolutely critical. We now have a situation where we have the Lyme disease community working closely with researchers, working closely with healthcare providers, at least some of them. So that kind of coordination is absolutely fantastic. So as an example of this, the advocacy side of things, that's the vocal event last year in Ottawa. And although you can't tell, I'm wearing my Ottawa vocal shirt under here. Some of the advocacy is is by necessity being out there and saying, look, this is a problem, we're not going to be quiet, and we're not going to be docile and curl up in a corner and die. And that's absolutely critical. Some of it has been drawn from the ACT UP movement that was probably, for those old enough to remember it, it was the really first major North American example of patients taking healthcare and research into their own hands and saying, no, we're not going to be guinea pigs. We're dying of this. We're the experts. We want to be in control. Now, of course, being Canadian, we're much more polite about this. Instead of people doing die-ins in front of Parliament, there was probably the most heart-rending display I've ever seen, a set of shoes with the names of people who had died or were too ill to attend in front of Parliament, and that row went on and on and on, and these were shoes from people. For my part, last weekend, I held a Lyme disease conference. You can tell by the green. And I'm actually very proud to say that that was one of the very few conferences where you had presentations from both sides of the debate. So at least at the science level, we can talk. And this was open to the public, and there was enormous, wonderful public presentation. And for those of you who are here, thank you for being there last weekend. I know it's like, if it's Saturday, it must be a Lyme meeting. Okay, so where does that take us? So the good part of working together, but with patients, researchers, and clinicians working together, is that we identify research areas that are important. So none of this, I want to deal with this incredibly obscure little area that matters only to me. We're identifying matters of importance and that meet patient needs and clinicians' needs. So it's a very powerful way to actually make progress, and we have. I'm not supposed to talk about diagnostics and treatments, but that's happening too. In terms of where we go from here, it was suggested to me that I don't just say, we've been let down, let's just curl up. There are things we can do. The first thing that people need to do is, if you are ill, please do everything you can to heal yourself. And that may mean taking time for yourself. If it is someone in your family who is ill, someone in your community, give them the support they need to get better. And do not stop until you are better. Next thing, try to stop other people from getting ill, particularly young people. I was 50 when I got ill, so I'm very grateful that I got my health back, but if I hadn't, I would have lost, 20, 30 years of my life. If it's a 5-year-old, if it's a 10-year-old, a 15-year-old, we're looking at decades of illness. So prevention is critical. Please be obnoxious. If people are not checking themselves after coming in, tap them on the shoulder and tell them to check themselves for ticks after they've been playing in the park. You see kids rolling in the long grass? It's wonderful. They're out there. They're enjoying the environment. That's great. Tell their parents to get them to check them for ticks afterwards. Okay, document your journey. It's critical. Our voices have to be heard. Lyme disease is very much a silent illness, a hidden illness. We're all tired of telling our story. I don't want to tell my story. A lot of people I've done this before. That story, our lived experiences have to be told. So write it down, please. Write it down in a place where you can easily do copy and paste. And skipping right over to number 5, yes, please do communicate with your MPs, your MLAs. There are people who know this is an issue who are willing to help. So there are roadblocks. It's not like there's this whole morass of people who are trying to suppress us. It's not a conspiracy. It's small areas of people with conflict of interest. But there are good people out there, and they need to know that this is what's going on. This is what they can do to help. They may be able to help. They may not be able to help. But please reach out to MPs and MLAs. Your voice does matter. If you feel like supporting research, that's wonderful. Make sure that the research meets your needs. And the next slide is going to be a quick checklist of some things you might want to ask yourself to figure out if it meets your needs. And finally, identify what your needs are. What are the local priorities? What's important in your community? What's important to you? What's important to your neighbors? What's important to your kids? Do you have teenagers? What's important to them? Identify your needs, connect with others who have those needs, and then act on them. Don't wait for anyone to rescue you. That's a good way of wasting a lot of time. If you're thinking about getting involved in research, yeah, I know this is like font size 14 or something, it's tiny. You can go pull this off the Lyme Hope website or the CLC website right after I put it up, or better yet, after I ask someone to put it up for me, because I'm too old to understand how websites work, but I have all these great kids in my lab who do it for me. So if you want to participate in research, what's going to happen with any materials you give them? Do you have the right to say, you can do this with my tissue? Or is it, here it is, do whatever you want and let's hope for the best? Are you in fact informed about the fact that your tissue is being taken if you're not, or if it's just one in a list of forms that you're signing off before surgery and you're too freaked out to ask what this is? There's not much you can do about that. How confidential will your information be? If you participate with one network, does that ban you from participating with the other network? For the CLC, the answer is no. And you might want to ask, when the project is done, what happens to my records? Is it secure, or is all personal information disposed of? Or does it live forever in someone's computer? Okay, I'm going to end with one of the best quotes ever, and it is still one that motivates me, which is, never doubt that a small group of thoughtful, committed citizens can change the world. It's true, we can, we will, because we must. So we are making things better. And, yeah, go for it.